Welcome to Practice Pearls. I'm Dr. Neil Skolnick. Joining me today to discuss diabetes distress is Dr. Paula Treef. Dr. Treef is a distinguished service professor of psychiatry and medicine at SUNY Upstate Medical University. Dr. Treef, welcome.
Thank you very much.
Let's start by addressing what is diabetes distress and why should we care about it?
So diabetes distress refers to the negative feelings and sense of emotional burden that are associated with living with diabetes. This includes feeling burnt out, overwhelmed, anxious, depressed, defeated. And it matters because distress affects diabetes. Diabetes is a disease that requires a focus on self-care. As we all know, you have to check your blood sugar, watch your diet, be active, take medications. And if you're feeling overwhelmed or depressed, you're just less able and less likely to do these important self-care behaviors. And also, diabetes distress affects your quality of life. If you have high diabetes distress, that means that you're likely having trouble coping and the quality of life is suffering.
Those are important points. What should we as healthcare providers do to address diabetes distress?
The first thing is to pay attention to it. The ADA recommends that providers screen for diabetes distress periodically, but especially when the person has first been diagnosed, when there's been a change in the disease itself, like the first complication occurs, when there's been a change in treatment, like insulin initiation, or when there's been a change in life circumstances, because other stressors are going to affect the person's ability to cope with their diabetes. And then the second is to measure it. There are tools available to measure diabetes distress at regular clinic visits, and these are on our website, and there's also a link below that you can go to. But you can also just ask. You can say something like, most people with diabetes have times when they feel sad or anxious about managing their diabetes. Do you ever feel that way? Or tell me about how you're feeling. Or what's the hardest thing for you about living with diabetes? These questions really start the conversation.
So, when you suggest this to providers, do they share any concerns with you?
Yeah, the big concern is usually time, but most providers now are regularly screening for depression, so adding a 1 or 2 item distress measure really should be feasible. And then the second concern is that patients are going to be upset, and then the provider won't know what to do about that. But I would say here to recognize that when you, as a valued healthcare provider, ask about a patient's distress level, you are normalizing their experience and you are helping your patient. Even brief education and support decreases distress. You can also offer a mental health referral or a list of resources like local support groups or links to websites like the ADA website.
So, if there were one take home message, what would that be?
Really, that diabetes distress is normal, but it can negatively affect a patient's self-care and their quality of life. So we as providers must accept our role in assessing and addressing diabetes distress to provide high quality, tailored care for our patients.
Dr. Treef, thank you for joining us today.
Thank you.
And thank you to our listeners. For the American Diabetes Association, I'm Dr. Neil Skolnick. For more information on diabetes distress and other topics that impact the lives of our patients, just go to the link below. Until next time, be well.